our IT guys are going to stream this to our YouTube page, so it will be recorded and y'all can watch it later if you choose to.
Thank you.
All right, I want to welcome everyone today to the Public Health Award reception in honor of Dr. Flazade, who is a longtime board member here for the Lake Cumberland District Board of Health. My name is Amy Tomlinson, and I'm the executive director here at the Lake Cumberland District Health Department. We're going to have several people to make some comments and some remarks today about Dr. Flazade. Just a little bit of history about this award that's being presented in his name today. The District Board of Health in December of 2021, last December, asked me to look into creating a public health award in memory of Dr. Flazade, since he had served such a long term and had done so much for this region. And I thought it was a wonderful idea. I thought this was one of the best things that they could have suggested. So I started researching and looking at other places that had done this, and found Lexington Fayette County has one similar for Dr. Leach. That was a longtime board member there, yes. So in March of 2022, this year, I presented some criteria to the board and talked to them a little bit about things that we could look at as far as who would qualify for this award in the future, because this is plans to be an annual award. This isn't a one and done, a one-time thing. We want to continue this award into the future. So we're looking at things for this award. You have to have exemplary leadership and diligence in promoting public health. You have to have remarkable contributions in support in fostering public health programs and work or actions that have impacted the community's health in a positive way. And so we could not think of anyone more deserving of this award than Dr. Flazade. This award is going to be awarded annually to a deserving community member during National Public Health Week, which is the first week in April every year. And Lake Cumberland District Health Department staff are not eligible. So this will be community members who are making a positive impact in our communities for the health. And in the future, this award this year is named the Lake Cumberland District Health Department Public Health Hero Award. In the future, this name will be this award will be renamed the Dr. Flazade Public Health Hero Award in his memory. On a personal note, this is going to be very tough, but on a personal note, I've known Dr. Flazade since first grade for me, 1981 roughly. He operated on me when I was a first grader, a very scared 7 or 8 year old child for appendicitis. And it ended up being more serious than appendicitis. There was actually a bowel obstruction and some infection and a much more serious case than what we originally had thought. Fast forward that to several 20, 30 years later, I've had the opportunity to work at the health department and witness him and observe him on our district board of health and on all of our local boards in different capacities. And there could not have been a more staunch supporter of public health than Dr. Flazade. Then in 2021, last year, Dr. Flazade served on the search committee to replace Mr. Crabtree, our previous director. And he actually was on the committee that chose me to be that replacement. And so I feel like that came full circle for us 40 years later, from the time he operated on me until 40 years later, that he was able to appoint me and suggest my name for this appointment. And I am so appreciative. So I can honestly say that Dr. Flazade has left a mark on my life, literally and figuratively. I have a very beautiful little 2 or 3 inch scar, and he has really impacted my life as a leader and as a director. He was much appreciated and irreplaceable in a lot of our staff's eyes and our agency's eyes. When I was inviting people to come to this award today, this reception, I had one board member who was not able to attend, but asked that he would be able to submit comments. So I have those in an email, and I wanted to share those on behalf of Dr. Bruce Jasper. And he says, my dad was on the old Somerset Hospital board. This was the old city hospital before the new hospital at the current location. So I'm assuming he's talking about across the street here. He was so pleased when they were able to recruit him to Somerset. Bringing him here was a big deal for what was then a small town hospital. I think his coming to Somerset encouraged many other fine physicians to come here over the years. As a Pulaski and district board member, he championed services for the poor and underserved. There was no denying his commitment to improving the health of lives of the people of this area. He is a great choice for this award. And he asked me to please pass condolences and memories to his children who are here today. So at this time, I'm going to ask Mr. Parker or Dr. Seatak, I don't know which one wants to go first, but from Lake Cumberland Regional Hospital to make a few remarks.
That is going to be very hard to follow. Those are tremendous remarks, and you know, and as you described this award, there's no one that could fulfill the description that you told about, and Dr. Flazade is the perfect choice. I met Dr. Flazade in 2004, so this was a while back, and one thing about Dr. Flazade, in my experience working with him over the years, was his, you know, the thing I wanted to share was his sense of humor. There was never a time I ever think he didn't make me laugh. And I must have met with him over the years, dozens of times, and he always had me laughing about some issue. He had a wonderful sense of humor. And so that's very true. And I think always just a beaming smile that always captured everybody's attention. And he kind of was the you know, the light in the room in many of our staff meetings. And Dr. Setak can verify this. There was a little bit of a joke in a sense that whenever we had medical staff meetings, when it was time to approve the minutes, you couldn't say it before you said make a motion. And then at the end of the meeting, when it's time to make a motion to adjourn, you couldn't, the leader of the meeting couldn't get that out quick enough for Dr. Plaza. They would say, I make a motion to adjourn. And it's kind of a joke, and the staff always laughed the way he was able to do that. His leadership extended clinically as well, for sure. He's very, very passionate about cancer care for the folks in our area, in our region. He was a leader in our cancer committee. Always there, always networking doctors. He would always connect doctors of different disciplines in these meetings to pull them together to talk and pour over individual patients. In those meetings, we meet and talk about individual people. And he was always very careful to make sure that we did that so well. His skills as a surgeon, Dr. Setak can certainly echo that in a few moments. It was just, he was renowned for that. He was always wonderful just to talk to on a personal level. He would pop by the office from time to time, and it was always just a wonderful highlight for the day. And we had wonderful conversations from everything from world affairs down to smaller topics, if you will. So I would just say I'm very honored to be asked to even comment today. I mean, that's very humbling to me to be even share these comments.
Good afternoon, everybody. I'm Mike Setak. I'm one of the general surgeons in the community, and had the very good fortune of coming to Dr. Flazade's practice and being a part of working side by side with him starting in 1996. At the time, I was very young and not much out of training, and frankly had a lot to learn, and became soon just realized how fortunate I was to be able to work alongside with him and underneath him. In many ways, he sort of adopted me almost like a son. We really hit it off good, and nothing was more fun to me than going to the operating room and learning what he had to show me, whether it be anatomy or some technique or some new thing he was doing that was just truly amazing. And it was just an unbelievable inspiration to me. Over the years, I began to realize his patients adored him. I would work beside him in the office, and patients laughed with him, they cried with him, they did many things. He was always extremely close to his patients and would just do anything for them. The staff at the hospital, they knew who was in charge. Okay, Dr. Flazade said he wanted something, you better get it pretty quick. You're gonna hear about it. Okay, so he carried a lot of respect, and it was well earned. And he just became my example through the last really 20 years or so that we worked together. He helped me understand a lot about a lot of things. One of the things he helped me understand actually was how to balance your life a little bit as a surgeon, because it's very easy to just get sucked into all of the things that are going on. And one of the things Dr. Flazade often did, we often had lunch together, just the way the clinic was set up, and he would tell me about his world travels and places he'd been in. I to this day don't know of anyone who's been more places in the world than he has, and I got to hear all about many of these trips. And he would tell me, he would say, do not wait till you retire or something like that. Go out, spend money, go enjoy some things, take your children, take your wife on things. And he taught me the importance of living a balanced life as a physician, because it's very easy to just get so absorbed in your profession that you forget you have other people who make it all possible for you. And he was an amazing example of that. I thought of a lot of different adjectives to describe him: compassionate, caring, skillful, selfless, dedicated. All those are words that apply to him. After he retired, he still really never let go of his work in our community. Obviously with the health department, which I was not as in tune with, but certainly at the hospital, he was there many days a week. He participated in our residence conferences, teaching. In fact, I would call him up some nights and say, look, I've got this very difficult case. I'm trying to figure out what to do. And here over the phone, he could give me some advice. He would go through things. If I had to sum it all up and just put one word on it, I would say it was selflessness, okay? He gave incessantly to this community, to his patients, frankly, to me. And many times I really have a lot of the success that I've been able to have and share with my patients due to the training he gave me here in this community. And certainly he's left a legacy that will hopefully forever be remembered, because it was well deserved and well earned. So I will certainly miss him very much. He was a big impact on my life.
This time, we're going to have remarks from Dr. Richard Miles, who's a close friend also and a board member. Dr. Flosky.
I'm humbled and honored to speak about my friend, Dr. Hussein Falazadeh, as the first recipient of the Public Health Hero Award, which is to be named after him. Dr. Falazadeh was a physician, an excellent surgeon, and he was a good friend. We only saw each other every 3 months, but we go back to 1974 when I was a sophomore in medical school and he was a chief surgery resident. And as Dr. Seatek would tell you, medical students live in fear of the chief surgery residents. But he was a friend. He was a gentleman. We shared an idea that Sir William Osler stated: medicine's a calling, not a vocation. As he's already noted, it went beyond business. It went into doing something that you felt you were called to do. We understood that in order to best treat an individual patient, we also had to treat the community, thus his interest in public health. I'm not sure how many years I've served on the Lake Cumberland Health Department board, but Hussein was here when I got here. And he supported the syringe exchange program when others on the board disagreed. He supported vaccines, masking, and our battle with COVID. He was usually the first one to make the motion to give a pay raise or a bonus to the staff. He had a great heart and a great amount of compassion for others. I'd actually known him long before I joined the health department board, as I stated in 1974 when I was in medical school. When Russell County Hospital first opened, we had a husband and wife surgical team. If they went on vacation, Dr. Falazadeh covered. He even came to Russell County Hospital to see some of the patients. When they left, he accepted our surgical patients in referral until we got a new surgeon. And then over the years, we had several surgeons come and go. And Hussein graciously agreed to accept our transfers until the next surgeon arrived. He understood our need to support our hospital surgeon. Not once did he admonish me for not referring patients to him when a new surgeon arrived. Of course, if a patient wanted to go to Lake Cumberland, I was more than happy to send them to Hussein because I knew that they would get quality, top-notch care. We both trained at the University of Louisville, as did Dr. Seatek, and the surgery department under Hiram Polk was considered to be the top residency in the Southeast United States. He was chief resident, assistant professor there. He was president of the American College of Surgeons, which means he was greatly respected by his colleagues from all over the United States. He served as chief of staff at Lake Cumberland Hospital, showing the respect of local physicians who worked with him. He's also published in medical journals, lectured internationally. I knew he was well-trained, but I also knew that more importantly, he cared about what happened to the patient, our mutual patients. He cared about his community. He wasn't always treated the best. During the Iranian crisis, I got word that he was given a hard time by some of the physicians over here. I called a man that I'd known for several years, who was a good friend of mine, that I think Mr. Kelly knows extremely well. And we had to talk. I said, you're a leader, you need to straighten this crap out. This man does not deserve this. He's a Persian. I'm Iranian. No, he did not deserve that. He was a good man and he was there working for the community. And Steve got into it, and I think Hussein got word of conversations, and that bonded us. We were friends after that. And there was nothing we wouldn't do for each other if we needed it medically. I was new to the area, and I always told Hussein that anything ever happened, he was more than welcome in Russell County. He appreciated it. Despite all those prejudices, he still gave top care to the surrounding area. I treasured the opportunities to meet him at our meetings. We were two old timers, and we love to regale the younger doctors with our stories, our war stories of patients and doctors that we knew in common. None of those are repeatable stories here today, but we discussed his loneliness and his sense of loss as his wife required long-term care and slipped into the forgetfulness of dementia. I believe that the service to Lake Cumberland District Health Department was a gift. As he interacted with us, he improved the district's health. He led on our executive committee, the finance committee, and at times as moderator of our meetings. He enjoyed the intellectual battles as we tried to educate and convince some of our county judge executives, who we understood were under community pressures not to allow some of the programs, as to the importance of COVID care and syringe exchange programs. I feel that naming the Public Hero Health Award after Dr. Hussein Falazadeh is totally appropriate, as this proud American made his life's work to improve the health of the people in this region and served for years as a faithful member of the board. I personally regret that I did not know that he was that ill until I was told his death a couple of weeks after he died. I would have enjoyed one more conversation with my old friend. And although I was several inches taller than him, I still looked up to him. I will miss his smile, his quiet laugh. Rick, I will tell you. I will miss that. So thank you for honoring my friend, Dr. Hussein Falazadeh.
Okay, I'm going to ask Pulaski County Judge Executive, Judge Kelly, to come up and actually make the presentation.
I just don't have lengthy comments from a standpoint of working with Dr. Falazadeh, but I do think, with maybe the exception of Dr. Miles, that I've known him longer than anybody in this room, because my as you mentioned, my father was in practice here when he came to Somerset. I think I remember Dr. Falazadeh coming over to the house, and several of the doctors were there, and I've known him since I was 5 years old, and saw him all around. And I will say this about the man: he was selfless, like you said, Dr. Seatak. And what I remember about, he's rock steady. He the same exact person that I met when I was 5 years old, treated everybody the same all through his life. And to the day he passed, he never moved from who he was. And I love that about him. He's definitely a leader for this county. I'm honored to be able to present this award. I can't think of somebody more fitting to receive this inaugural Public Health Hero Award than Dr. Falazadeh. So with that, I will invite his daughters, Doctors Susie and Nicole, and you're going to have to forgive me, which is Susie and Nicole. If you all will come up here, and I'd like to present this to you on behalf of the Board of Health. So it says here, 2022 Public Health Hero, presented Dr. Hussein Falazadeh, in recognition of your dedication and service to the promotion of public health in the Lake Cumberland area. So I will give that to you and say congratulations, and we're so proud to have known this fine gentleman.
Thank you so much. Well, I'll try to say a few things. If Dad were here, he would have a lot of witty comments to say. I can't say that I'm as good of a person as he is with that. I have a few notes here, so I'll pull them up. I knew my mind would go blank as soon as I got here. So, my father was a man of the world. He was born in Iran and left there in 1958 to go to Birmingham, England to attend medical school. And after 11 years there, he came to the United States and did surgical residency at University of Louisville. After that, he came to Somerset. He also traveled to over 50 different countries. And of all the places that he had been, it was Pulaski County that he called home. When my mother became ill and she wasn't able to be in the house anymore, we tried to get him to move to Lexington where his daughters and his grandchildren live. And he said, no, this is where I belong. this is where my people are. This is where I have maintained friendships for decades and had my career. And as I've become a doctor myself and my sister, we both realized that what big shoes we had to fill. And I don't claim to fill them because he had a level of compassion for his patients that is very rare. And he just wanted nothing but the best for the people of Pulaski County. And, Dad had a bit of an ego, and he would just love to see all this right now. And my hope is that he is watching this right now. Thank you guys so much. It was wonderful to hear these wonderful stories about my father. And I appreciate it. And it makes me very happy to think that his name and his legacy will live on. Thank you so much.
This time, I just want you all to have snacks and refreshments and enjoy some visitation, share your stories with his daughters. If you knew him personally, or if you have any fond memories of him, I'm sure they would love to hear those as well. Thank you all for coming today and participating. Appreciate you.